Welcome to Michigan Reimagined, presented by T.A. Forsberg and Wagoner Financial. And here's your host, Chris Buck.
So healthcare has historically been an important topic, but recently navigating our way out of a global pandemic, the financial well-being of healthcare providers, nurse and doctor burnout are just common news topics. Here to talk about a new partnership between a university and a century-old healthcare system are Frank Urban, the Director of Venture Creation for Spartan Innovation at Michigan State University Research Foundation, and Lisa Prasad, Vice President and Chief Innovation Officer at Henry Ford Heath. Thanks for coming in today, Frank and Lisa.
It's a pleasure to be here.
I meant to confirm the pronunciation of your last name. Did I get it?
Yes, Prasad.
Okay,
yeah,
great.
Perfect.
Wonderful. So, Frank, let's begin with you. The Michigan State University Research Foundation. What is it and what exactly do you do there?
So the MSU Research Foundation is a 501c3 not-for-profit. So we're there to support MSU. Our mission is actually to support MSU's ecosystem when it comes to innovation, research, translation, basically moving their technologies forward through startup companies. But we do a lot more than that. And since MSU is a premier land-grant university that's all over the state, we also kind of follow all over the state. We've got offices in East Lansing, of course, but Grand Rapids, Detroit. We also work up in Traverse City and even in the UP in some cases. But really, we're there to add that translational piece to it and kind of that transitional piece as well. And so what we do is we kind of put the plan, the people, and the funding all together to move technologies forward. So we've got 4 different subsidiaries. Spartan Innovations is mine. I work on the life sciences, but basically we're the startup arm. So we start companies. We go all the way from ideation. We work with research faculty at the university. We help with grants in some extent. And then we help to bridge, our faculty members over to startups and other corporations. But we also have Red Cedar Ventures and Michigan Rise, which are our venture arms. And then we also have SHAPE, which was an NSF Engines grant for circular economy. And then we have a number of incubator facilities and accelerators all over East Lansing and Grand Rapids as well. And we work at New Lab in Detroit.
Fantastic. Okay, wow. So I think of innovation when I think MSU Research Foundation, I think of innovation and startups. But in my intro, I talked about a 100-year-old healthcare provider. So Lisa, why don't we spin it over to you? Talk to us about Henry Ford Heath and what your specific role is over there.
Sure, thank you. And it's a pleasure to be here. Henry Ford Heath is a integrated healthcare system headquartered in Detroit. And what I mean by integrated is that we have providers, which are the hospitals and the care sites, and we also have the payer, which is the Health Alliance Plan. So we're fully integrated throughout the spectrum. We like to say that we have everything from pediatrics to geriatrics. We have everything from primary care to quaternary care. If it's happening in healthcare, it's basically happening in Henry Ford Heath. We have, some of you may be aware that we recently completed a joint venture with Ascension's Southeast Michigan facilities. So even though we are now over 100 years old, we continue to grow.
Right.
And we now have 13 acute care hospitals and over 500 care sites throughout Southeast Michigan. I have the pleasure of leading Henry Ford Innovations, which is the innovation arm for Henry Ford Heath. We were founded by Henry Ford, obviously, as our name suggests, and so we like to say that innovation is in our DNA, but there was still the need to have one unit that captures the lightning in a bottle, the one unit that actually worries about how do you take ideas and turn them into inventions that can actually help patients. So we were created about 15 years ago. And our mission is to improve healthcare and outcomes for our patients. It's to help recruit and retain the highest caliber of clinicians to Henry Ford and to the region, and to really broaden our economic impact on Michigan, particularly Southeast Michigan. So we do all of those things, and I'll talk about our company creation and other specific projects.
Wonderful. No, that's great. So knowing that you're both steeped in innovation and moving the needle forward and doing things differently than we have in the past, what do you think, like the patient journey in the healthcare system and how that all functions is going to look like, say, in the next 25 years? And how is your partnership between your two organizations helping to move that forward. Lisa, why don't we start with you?
Okay. I think the patient journey will be very different in the next 25 years for two reasons. One, because we have a shortage of doctors and nurses. And two, because we have an abundance of new technologies that are hitting the market. So if we think about how we access other services like Amazon, for example, and I get this all the time, is why can't you people be more like Amazon? So if you think about other industries, people are used to having these digital interfaces with whatever service provider they need. We don't have that. If you've tried to call a hospital or a doctor's office recently for an appointment, one, you've got big wait times, and two, you've got a long wait for an appointment. So we're trying to deal with both of those challenges by creating things like digital front doors, where we could have high-tech, low-tech, and no-tech options for accessing. But the other question is, how will healthcare be provided in the future? And I really see much more individualized care being provided and 4 tiers of providers. And it's unclear how systems such as ours will play in each of these tiers, but the first tier will absolutely be at-home care. And video visits became such a popular thing during COVID, and it's gone down since then, but still it's beginning to ramp back up, and we're seeing home care for we're seeing hospital at home, for example, and other different types of more specialized care that can be provided in the home using remote monitoring technologies. So that's going to be the first level. The second level is going to be retail clinics. In 2021, Henry Ford partnered with a company called Go Health to offer retail urgent care facilities throughout Southeast Michigan, where you can go if you have a broken bone, for example, or if you have something less acute that needs immediate addressing. Then the third tier will be your ambulatory care sites, where you can go for x-rays, you can go for GI or cath labs, you can go for maternity care. And then the fourth level will really be hospitals, such as where I work at Henry Ford Hospital, your super specialty hospitals where you have inpatient, you have the complex care, you have the ICUs, you have the highly trained physicians to take care of very specific disease types. So the patient journey will be specialized, and it's really amazing that we now have the technology where records can be kept for you as a patient, regardless of which one of these facilities you go to. So it's going to be individualized, it's going to be digitized, and hopefully it'll be way more attainable.
Got it. And so, Frank, hearing all of those things and the evolution of these 4 stages, how does MSU's Research Foundation help move innovation that's required to get, Lisa's vision to where it needs to get to?
Yeah, and I think there's a couple of things to just think about. So, number one, if we go back even just 20 years ago, everything had to be typed out. Nobody was using computers. There was no integrated networks. And, you would just see so many patients per day. And what we see is technology just making that innovation so much faster. We've got to see more patients. We've got to do more with less. How do we really span our resources? And that's where technology comes in. I don't see that technology is going to replace the physician or the nurse. It's going to augment what they do and make what they do faster, more efficient, easier, because our population's increasing. And like Lisa said, we have a shortage of nursing or physicians to treat these patients. So how do we do it all faster and more compact?
Right.
So one, I think, is dissemination of healthcare, putting more on the home. So sending people home with wearables, having AI that can kind of flag issues. So if you've got like a normal heartbeat and you're exercising and everything looks good, fine. And we talk about monitoring patients at home, but really it's red flagging. Do we see like an atrial fibrillation that we have to worry about? Is there things that are happening metabolically that we have to worry about, like glucose levels, things like that? And then I think it's going to be a real focus on, finding issues earlier, So when we find things later, it's harder to fix, harder to change. It costs more money. So there's going to be a big, I think, push on diagnostics and finding, cancer earlier where it's more treatable, finding metabolic diseases where you can work on it before somebody ends up having to have a glucose monitor and having to have a glucose pump. I think innovation's doing that. And so now we see this revelation in healthcare that's happening, and with the technology. The problem that we have, and that what innovation also has to worry about, is the equity. So as healthcare progresses, so does that divide between the have and the have-nots.
Right.
A lot of it's taking place on the internet, and high-speed internet, which some of us take for granted. Some people don't even have. Some people don't even have good cell phone access. And when you think about rural areas, their hospital might be 50 miles away, and they might not have all the resources, that we have, like in cities, and urban areas have their own issues. But how do we make sure that we take care of people, but we do so in an equitable fashion so people aren't left behind? And I think that's technology's big concern and big issue, is we need to move healthcare forward, but we need to move it forward for our entire population, not just part of the population. And that's something that I think technology can do, but we have to have the purposeful mindset of creating in that area to do that. And I think that's where a lot of the innovations that's taking place at both Henry Ford and Michigan State University is happening. And our challenge is, how do we take that great technology and that great research that's being invented and commercialize that so it actually hits the population, and it hits the whole population, not just part of the population.
So kind of related to that, what does the healthcare team look like in the future? You talk about shortages and you talk about technology taking over. Is it still going to be exclusively doctor-patient communication, or is there going to be some sort of an interface that's digital or robotic or something along those lines?
The relationship of the future between the doctor and the patient will still be a relationship between the doctor and the patient. I'm convinced of that. But it will be different than what it is today. And part of that is we can't ever talk about technology without really appreciating the fact that we're going to have a doctor shortage of over 100,000 doctors in the next 10 years. We're going to have a nursing shortage of over 500,000 nurses in the next 10 years. And this is because the demand is going down and the supply is going up. We have an aging population that requires more clinical care, and we have an aging population in which doctors and nurses are retiring, and there are not enough new ones being created. So that's one big problem, and technology is actually a solution to addressing that. So you will still see a doctor, but they will rely way more on technology to understand you as a person, to understand your personal data based on your health history. When you go to the doctor's office, they may already have run an algorithm where it indicates that you should be tested specifically for diabetes or cardiac conditions or whatever your personal health history might suggest. Clinicians will no doubt be better trained on technology. So you might have much more engineering and digital health classes that are being integrated into medical school curriculums. Surgical teams will likely rely a lot more on robotics to ease their load, but also to improve outcomes. So the doctor-patient relationship, I don't think will go away, but there will certainly be a lot more reliance on new technologies and digital technologies.
Right, out of necessity and for efficiency cases. So, Frank, I know you already have a stable of startups that are kind of coming and going through the ecosystem of the foundation. Are there any specific types of technologies that you're trying to foster to be prepared for the future that Lisa's kind of describing here?
I would say that we do. There's a lot of AI technologies. We do everything: therapeutics, diagnostics, med devices, AI, software as medical device. You kind of name it, but there's so many needs within the healthcare system. I think the challenge for the startup companies, though, is it's not just creating a great technology. It's being able to manufacture that technology at scale. It's being able to look for the issues that come up with biases that will come up in like AI data, for an example, how to access that data, how to understand the regulatory environment and traverse that environment, how to make sure that when you're going to the hospital, you work through workflows and you're able to work in the system. And then where electronic healthcare records are concerned, am I creating data that can easily go over to those electronic records, which then become accessed by the doctors and nurses and other care providers, so that they can utilize that data that you're producing and be able to look at the whole person. And really, that's where technology should be able to come in, is not just a simple exam where you come in and you get looked at and I see a snapshot of you there. I think what technology is moving towards is, with our devices, wearables, monitoring, all of that, we're looking now further into that and we're looking at the whole person. And there's really not an area of technology that healthcare doesn't touch. You can look at mobility, huge issues on getting patients into the hospitals, moving those patients around, making sure they can get the care that they get. Electronics and IT, that's obvious that's there, but then there's the healthcare specialties, the pathophysiologies, everything like that. But I think you're also going to see a lot more diffusion into specialties. So specializations are going to become there, and you'll probably see a lot more where the technicians come in that are specialized, because just like Lisa said, it's no longer just medicine. Medicine now consists of medicine, IT, regulatory specialties, coding so that you can get paid from the payer organizations. It moves over into engineering. It's multifaceted these days. So unlike before, where a doctor could just look at the patient and say, okay, well, I'll prescribe you this drug and we'll do this. Now there's a lot more information coming in, and how do they look at that and get kind of the bigger picture of how to take care of that whole person? I think that's where healthcare is going. But we see a lot of technologies moving in that space.
Wonderful. Well, I want to give a nod to our friends at the Forsberg Real Estate Company. When it comes to creating the best living and working environments for the community, no one does it better than my friends at the Forsberg Real Estate Company. Brent Forsberg and his team of create vibrant, holistic communities that inspire growth and encourage belonging. Focused on building stronger connections for people, the Forsberg project is always in tune with balancing the relationships to create the optimum human experience. Since the 1950s, Forsberg's have been enhancing the qualities of life in the communities they serve by following the principles of regenerative growth and aligning the resources and tools available. Reach out to my friends at the Forsberg Real Estate Company by calling 517-349-9330 or check out their website at lansingrealestate.com. So you mentioned AI, and so I want to ask Lisa, I've seen AI do amazing things, and but there's also a lot of narrative out there about it being maybe a little scary. So what do you see AI's incorporation into the healthcare system? Because clearly, based on everything you've already discussed, everything needs to be really efficient and as automated as it can be, so we can save the doctor's technical education for where it matters the most. So how do you see AI moving into this? And is your confidence level high that that's going to be safe?
I'm very bullish on AI, and this is something that we can talk for hours about because everything is going to have AI incorporated into it, just like everything is digital now. So first of all, I don't think we should be scared. I recently read an article which said AI is less like driving an elevator and it's more like driving a car. So when you get into an elevator, you press a button and it takes you exactly where you want to go. You don't have to think about it. AI is not that. We're going to have to think about it. It's like driving a car. You get into your car, you have to know where you're going, you have to know the directions to get there, you know when to brake, when to accelerate. So it's going to require a little bit of work, but boy, is it going to have a positive impact on our lives. And I am a very big believer of that. Right now, if you talk about where AI is being used in health systems such as ours, we really, I think about it in three overlapping pillars. The first one is administrative work. So administrative work is very, very plentiful in healthcare, and we're already seeing the benefits of this in areas such as revenue cycle management. So, for example, AI algorithms can provide forecasting models on the expected value of a claim and the likelihood of a claim being denied or accepted. which allows systems to plan for what procedures they're going to do and how they're going to handle the billing side. So these are sort of low risk, high value. Patients never see this and never should. But they add high value to the institution. So there's a lot of these administrative workflow AI technologies that are already being implemented and that are adding value. The next pillar is what we call technologies that unburden the provider. So most of us are used to using MyChart to make our appointments, or more importantly, to communicate with our physicians. One cool technology that we're using now is the Epic Copilot for the inbox. So let's say that I'm going on vacation and I need a blood draw. So I put my message to my doctor, Dr. Smith, I need a blood draw. Now, Dr. Smith sees my request, and I am one of 50 requests that she's gotten in that day. So she responds with a very curt message saying, go to the lab at 8:15. Now, what the AI is now going to do is it's going to draft a response for Dr. Smith so that all she has to do is approve that draft and hit send. And it's been shown that not only are these responses accurate, but they're also more empathetic than what Dr. Smith might have done herself. Because Dr. Smith is just trying to clear her 50 email messages.
Right.
But the bot can be empathetic each time, every time. So we'll see more and more of those helpful technologies. And then the third is really direct clinical care and patient interaction. I think other than in areas of, say, radiology and maybe pathology, we haven't seen a lot of direct clinical care or patient interaction types of AI. But I did recently learn of a company that's using natural language processing to create a virtual nurse. And this was so realistic. It was amazing. And they did a demo with me as a patient. And the nurse Helen, I think they called her. So Nurse Helen actually talked to me and said, Ms. Prasad, we were just released. You had a knee surgery done. How are you feeling? And I said, I'm feeling okay, but I'm having pain. So then the nurse went off and asked about the pain medication that was prescribed at the hospital, because she got that from looking at my chart. She followed up, have you been taking your lisinopril? And have you been eating well? And I said, well, I didn't eat my meatloaf. Just to test Nurse Helen. And Nurse Helen comes back to me saying, well, it's very important to eat your meatloaf because the beef has protein in it and you need protein. Can I give you some other recipes for meatloaf that you might like more? I was blown away. But these are the types of technologies that are really going to help patients, I think, and reduce the burden on the provider at the same time.
Well, that's fascinating to hear. So, you're both bullish on fostering spin-ups and supporting entrepreneurship. If you were able to, make a startup exist, if you were able to court someone who's going to fill the biggest gap, Frank, what type of technologies would you want a startup provider to bring to the table and innovate?
Yeah, and that's a really tough question. I think there's just so much out there that needs to be done, and how would we do that? But I think, there's a lot of innovation that's happening, but it's got to also touch home to the person. So it's got to kind of be this precision medicine, one patient or individual at a time, and how do we assess and make technologies more personable for individuals? And if we look at, for instance, mental health right now, it's another crisis that we're kind of having. We're having a bit of a, mental health crisis for a couple of reasons. Number one, people are just getting inundated with technology. The number of inputs that we're taking in are a lot. People are just getting overloaded, and our family structures aren't quite like they were in the past. So, there's been a number of different technologies that have come out trying to help people to get balance in their lives. So, think of faith, family, work environment, learning, continuing. And so, I think those balances are great. And you see individual apps come out for healthcare, and you see them come out for what should you eat and how should you exercise. And there's a number of those. But a lot of people are starting to integrate those now into these wellness apps, and wellness, goes beyond like, well, don't eat that cheeseburger. You can make this at home, and it tastes better, and it's going to be better for you. And then, you can follow your calorie counting and things like that. And I think when you add these technologies, so you've got the applications, you've got the medications, you've got all these things that come together, and bringing those together, I think those technologies have a lot of traction, especially with people, because people are looking for answers. But if you're like me, I've already got 500 apps on my phone. How can I narrow those down and have something that does more? And then also, I think, integrating those with healthcare, because healthcare doesn't stop at the hospital. Healthcare is a continual event that follows us everywhere we go. So we have to have the means of monitoring kind of our own health. And if we're able to do that, then I think that, again, it's technology that enables, but we can then monitor our own healthcare. Maybe we don't need to go to the hospital as often as we do, or maybe we're not as sick as we are, or maybe we take the proper precautions for the environment that we're in. And this whole area of preventive care or even early diagnosis, so that we can help the healthcare system out and not burden it so much. And again, for our own mental health and mental wellness, if we can take care of ourselves, then the providers would be so burdened and have to come in kind of after the fact and work with people. But that's where I see technology really having this just kind of fascinating interaction with people. But I think wellness is a huge part of that.
No question. And there's so much to unpack. Unfortunately, we're getting close to running against the clock. But I want to thank our friends at Triterra. Triterra is a well-respected environmental consulting firm headquartered here in Lansing, Michigan, with staff around the state to serve your brownfield redevelopment, environmental consulting, and natural resource management needs. Since 2008, Triterra has been successfully assisting a wide range of clients by implementing effective solutions to complex environmental challenges. If you're a developer, a property owner, a business, a lending institution, attorney, or governmental entity looking for a creative solution and want prompt and timely service, contact my friends at Triterra. You can't miss by calling them at 517-702-0470 or check them out at triterra.us. Again, unfortunately, we are getting close to the clock time, but I just want to ask a good closing question that we can spend some time on. There's a lot of studies that show that the quality and effectiveness of healthcare in America is deteriorating, but there's all this technology that's coming in to help improve that. Where do you think we stand on the technology improvement and healthcare systems kind of declining, and when do you think those reports are going to start leveling out and seeing the improvements based on all this effort that you folks are putting into the technology side of this equation?
Well, I can take that one. Only 10 to 20% of a person's overall health outcomes is actually determined by healthcare.
Sure.
So when we're thinking about all of these technologies being created, they're impacting that small piece because they're not impacting social determinants, at least the ones that we see at the hospital. They're not really impacting individual behavior. They're not really impacting genetics. So we can implement technologies every single day, but again, we're only impacting that 10 to 20% that actually has to do with medical treatment or pharma or clinical care. The paradox of all of this, of course, is that as more and more technologies are being developed, they have a cost associated with it, and the benefit often goes to people who can afford the technology. So if you can afford to wear a smartwatch that collects all your data, well, yes, you have a lot of data and that could be useful. But what about if you can't? So there is the need, I think this is where Frank started this conversation, is as we think about creating the new technologies, we really have to be mindful that there is equity behind it, that everybody can apply the technology equally to maintain and address their health.
Got it. And Frank, what excites you most about what you're seeing in the ecosystem in this space?
I think as well as understanding like what technologies we can create to make things better, we're also learning about, what we need to do as a society to make things better and where we need to focus and where we need to move to. But I also think, just like kind of like Lisa mentioned, I'm a big person on the wellness side, and can we do things at home versus doing things in the clinic? But, you do see a lot of these really innovative startups that are coming out with new ideas, bringing into things that, we've never seen before. AI is kind of a tool. It's kind of like the BASF. We don't make the technologies you use, we make them better.
Right.
And you see all these augmentations happening. So we could do things today that we could never even think of, even just 5, 10, 15 years ago. But also the research is moving faster as well. Now we're doing gene editing. We're creating nanoparticles that can deliver RNA for specific, changes. Radiology is changing now, where we have MRI, PET, CT. We can combine all of those images together. So there's a lot happening there, but I really do think that technology is just multifaceted. So a number of different industry verticals coming together to create new products. And small businesses, which is where I work at, are great at the ideas and innovations and finding these new niches. But with the larger companies, you now see that they're getting more of an M&A strategy. So they've shifted their research from doing a lot of the basics to doing a lot of development and then integration. And you see a lot of these larger companies absorbing the smaller companies. And so really the small businesses that we're focusing on, that's really where a lot of the innovation takes place. And then the larger companies is where a lot of the integration takes place. And I think it's really fascinating to see that, because you see all the exciting startups coming out, all the individual technologies, and then you have the Apples, the Googles, the Microsofts that are acquiring all these smaller companies. And if you even look at your Apple, it's a phone, it's a computer, it's a camera, it's my alarm clock in the morning. I can look at Facebook on it. It does all these things all in one technology, and no company could do that. It takes, a large development company with all these smaller companies that they acquire and license in technology from to really do it. And that's where I see Michigan having an advancement, is we're really building that small business enterprise for, to be attractive to these large companies to come in and say, hey, we could take your innovations, we can integrate that and come out with the products that you need for tomorrow.
That's fantastic. I've obviously been following the Michigan State University Research Foundation for a while. I know a lot of the folks in your camp and see the sincerity and the efforts and the results that you're providing. But Lisa, I have to really applaud your vision and Henry Ford Health's vision in partnering with an entity like this that can help drive these technologies forward to, provide better outcomes for everyone you touch and be a model for relationships like this between academia and actively 100-year-old, healthcare providing solutions. It's solution providers. But congratulations on the partnership, and I'm so proud to tell your story.
It's been tremendous.
And as if you break through any major walls or have anything else, please keep me in mind. I'd love to share your story in a chapter 2 of this conversation if you're back in town.
Yes.
Absolutely.
We would love that.
Wonderful. All right. Well, we've been talking to some pretty dynamic folks here. We've been talking to Frank Urban from the Michigan State University Research Foundation, and Lisa Prasad, the Vice President and Chief Innovation Officer from Henry Ford Health. Thank you so much for joining me here today.
Thank you.
Thank you.
And I'd love to give a final shout out to my loyal sponsors. You got Forsberg Real Estate Company, Wagoner Financial, Triterra Environmental, Good Marketing, Keller Williams Advantage and Team, Michigan Rise, and the attorneys at Foster Swift. All fantastic people that are worth the call. Please like and subscribe to Michigan Reimagined on YouTube, Facebook, and all the places you find your podcasts. This is Chris Buck signing off for Michigan Reimagined.